Hey everyone, Dr. Alex Tam and Rocky here again. We are back with our Health Tips podcast, and today we have a very special topic. It is very personal to me because my grandmother had neuropathy and she lived the last 5 years of her life in a wheelchair and eventually getting an amputation in her feet. So I really, really love talking about neuropathy and educating people on neuropathy. So, Rocky, what type of conversations or are people having regarding neuropathy?
Right. So actually, today, Dr. Tam, we're going to talk about the realities, right, of having neuropathy. So over 30 million Americans have diabetes, and
Mm-hmm.
most of that 30 million is undiagnosed. So
Mm.
they may not know the realities. They may not know that they're already having these symptoms. But one of the things is one of the things that they commonly ask is, what is diabetic neuropathy?
Yeah, I mean that's a very common question we get in the office all the time. Like, hey, do I have neuropathy? Do I not? What is it? Right? Well, neuropathy, when you look at diabetic neuropathy, a diabetic person or person who has diabetes means that they have too much sugar in the blood. Too much sugar in the blood ultimately stresses out the pancreas because the pancreas has to send out something called insulin to bring it back for the sugars to be processed. It stresses out the liver. But not only that, too much sugar in the blood, it's almost like acid to your plumbing. And what it does is that it starts eating away the cell wall, the blood vessels, and now you have the inability to provide as much oxygen to the rest of your body, especially the areas that is furthest to your heart, which is usually where it starts. The problem starts in your feet or the tips of your fingers, your toes. Numbness, tingling starts to set in. And if untreated, it can lead to the dying of the cells, the nerves, right, on top of the burning, tingling, numbness, pins and needle sensations. And when it gets bad enough, that's where amputations have to come into play because an infection can actually happen.
Right. And talk about, being untreated. Let's talk about being undiagnosed first,
Mm,
right? So a lot of the symptoms of diabetes won't really show up until it's like at the worst. Is that
right,
right? Right.
right. A lot of people with neuropathy actually are not diagnosed because it always starts off as like uh, a little bit of pain here. Maybe they're not able to sleep as well at night and they can't have their blankets touching their feet because it's so irritated to the point where they get some pins and needles here and there at the beginning. It's always just here and there. They look at their A1C, oh, well, it's only 5.8, 5.9. Anytime it climbs above 5.6, 5.7 on the A1C, that means your liver and pancreas is actually failing to get the sugar back into processing away from the blood. When you hit into the low sixes and sevens, you're full blown diabetic, right? And a lot of the undiagnosed people who are undiagnosed, because it's not too bad. I mean, we've all been a done this where it only happened this one time. I'll worry about it later, but eventually it starts affecting their lifestyle where they can't wear the same shoes anymore. They can't walk for a long time. They are not able to stand for a long time. It wakes them up at night. It keeps them from sleeping, cramping of the feet. Now they can't go to the grocery store. Maybe they can't go on trips anymore, right? Because of how bad it is. When it starts affecting someone's life, that's usually when someone takes action. I urge that people who have diabetes to get at least every 6 months a sensory checkup to see if they're starting to develop neuropathy.
And speaking of developing symptoms, doc, it was also said, can diabetes show up as, sciatica? Can it cause back pain? Can it cause those symptoms at first?
Yeah, well, sciatica means that it's affecting the sciatic nerve, right? When someone has diabetes, there's no doubt that their bodies are not going to function as well as they would normally because the body is inflamed, it's in distress. You're diabetic, you're failing. There is peripheral neuropathy that it can cause, which is the tingling, pains, numbness, and it could be in your toes. It can work its way all the way up towards the knee. So it usually sticks with the lower leg. In the arms and hands, it'll start up in the fingertips, but it can work all the way up to about the elbow area. It won't usually cause sciatica, but inadvertently, unrelated wise, if someone who usually has diabetes will usually have elbow, shoulder pain, or knee pain as well, because they're just not going to be as healthy. And it's not uncommon for someone who has diabetes and over a long period of time can eventually develop sciatica, right? Where their posture might not be the best. They're not taking care of themselves as well. They might have separate pinched nerves in the back because most people with diabetes are not going to be the same people who are working out consistently to keep their body strong, right? So it's not going to be a direct causation, but it can be related. Absolutely, 100%.
Right. Okay. Great. Now, um, what is the mindset, right? What when we talk about, of course, it's diabetes and all that. A lot of people find it hard to really break through from their usual cycles. So, what is the general mindset that we need to change when it comes to diabetes and neuropathy?
Well, the biggest thing that you have to do is you have to be committed to change. See, and that in because a behavior, something that you did led you to diabetes. Unless if you're type 1 diabetic, you acquired diabetes somehow, right? And because you acquired diabetes somehow, you need to figure out what was the behavior that drove you to become a diabetic. And we need to undo those behaviors. A lot of those behaviors are sedentary, lack of exercise, right? And it is food choices, choices of foods that we make. Are we eating too much sugar? Is it too much protein? Is it too much fat? Right? Is it all the unhealthy stuff? That food is probably the worst. Okay. It's the hardest thing to break. I have patients
I
that look
agree.
at, right? They look at the list of foods that they should eat and shouldn't eat. And there's a forbidden list that we have. They're like, well, if I can't eat this, what am I going to eat? I say, well, here's a whole set of recipes on foods that you could eat, and I verified as good, right? So Dr. Tam verified. But it's the mindset is you got to be ready to make the change. And the hard reality is also sometimes we have to see, and I call this kind of forward pacing your years. Think about future pacing it. If you do nothing, okay, if you have diabetes right now, you're listening to this, you have neuropathy, or you just have diabetes, if you do nothing to change your life and the path continues the same, what does your life look like in 3 to 5 years? Most people will say, well, I'll get an infection. I might have to amputate. I end up in a wheelchair because you can't walk anymore. You have to use a walker. And knowing that, I asked him, I said, how does that make you feel? How does that make you feel to know that you could be in a cane, walker, amputation, or a wheelchair? How does it make you feel? And if it feels like you can accept that, then that means you're not ready for a change. But if you feel like, well, that's not how I want to live. That's absolutely not how I want to live. Now you're ready for some change. You see. So that's where the mindset comes in.
Right, right. Okay. Now, what are the treatments that you could recommend when it comes to neuropathy and diabetes?
Yeah, neuropathy can definitely be reversed, the symptoms of neuropathy, right? And you got to get your diabetes under control. If diabetes, I mean, there's multiple reasons why people can have neuropathy, right? It could be pinched nerve, it could be diabetes, it could be cancer, it could be alcohol induced, medication induced, right? Different things. If it is neuropathy from diabetes, number one, you have to figure out ways that you have to control the diabetes numbers in order to start reversing the neuropathy. There are oxygenation, okay, therapies that we can do to increase the oxygen levels and angiogenesis to regrow some of the blood vessels, right? Vibration, certain vibration therapies at a very specific frequency. There's rebuilding of the nerves and a nerve re-education system that we use as well, on top of different supplements and vitamins to help feed the body, the nerves, and nourish all the red blood vessels back to where it should be. Think of a rainforest that's been at droughts, right? And we're trying to re-nourish the rainforest back. That's what it is. It's not going to take one thing. It's going to be multitude of things, right? The fire coming through the rainforest is like someone eating cookies and pancakes all the time. All right. You got to stop the fire. You can't have the fire and try to grow things back all at the same time in this beautiful rainforest. See? And that's what the message I want people to get is there's got to be multiple things. But first thing is you have to be committed. You got to be committed to making that change first.
Right, right. And most of our of people who have diabetes realize that or think that it's the dead end. When you do have diabetes, it's a dead end, right? You
Right?
can't do anything about it anymore.
That's what they're told.
Right, right.
They're being told that by Western medicine all the time. Oh, once you have diabetes and once you have neuropathy, it's just, you're going to have it. It's just going to get worse until you die. No, that's not true. All right. All the people that we've helped over the years, it's not true. See, your body can change, your cells can renew almost every 4 months, right? Your blood vessels completely renews. Your stomach lining renews itself every 5 days. Your liver every 30 to 40 days. Your whole body is almost a different body every 5 to 7 years. So your body is consistently exchanging over cells and churning over cells. It's up to you to put in the right information so that your body can build the right cells so that you can get better. It's not going to happen overnight, but over time, it's going to happen.
Absolutely. All right. Okay. Well, that sums up our first topic for this year or through the end of this month rather. So thank you very much, Dr. Tam, for sharing this information with us. And if you haven't yet, please like and subscribe to the to our channel. And also, if you need help, please don't hesitate. You can give us a call, you can send us a message. We'd be happy to reach out to you guys as well.
All right. Thank you so much, Rocky. We'll see
Thank
everybody soon.
you.
Take
Bye
care.
bye.
You made it all the way to the end. Thank you for watching. If you loved this video, make sure you like and subscribe and watch one of these next videos. I'll see you on the next one.